Hello everyone, and welcome to another audio podcast in this series, the Equity Intermission. This is the Shientist, and I'm going to talk to you today about science through art, and this is side B of this particular art book initiative. And to do this, I'm going to highlight the different themes, and also I'm going to highlight a little bit about the works in relating to the collaborative effort between the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group and KDARs for Kids. This is once again another Storm Lobostics production, and this is the final audio podcast in this particular series around the equity intermission. So to begin with, I'm going to highlight that this has much like side A or book A, this has several themes. This has a theme on CKD or chronic kidney disease, the fundamentals, CKD by volume, before CKD, restriction, the renal replacement therapy and technology, strength and during strength, and then a theme around during CKD, and then a theme around resilience, a theme around ongoing tests and investigations, a theme around science and research, a theme around the fatigue, a theme around post-transplant, a theme around a theme around the medication, a theme around a gift of life, a theme around young people, a theme around empowerment, a theme around the Renal Patient Support Group and the Kidney Disease and Renal Support Group on KDARs, and then some theme around there's some conclusions, and there is a section on dedications. Ultimately, the idea of this art book, or side B, is to improve educational support for patients through art, keeping renal critical. And so a little bit around some of the aims, and to do that I'm going to highlight what the book actually looks like. So here is the front cover of the book, and here is the inside cover, the first page, which is CKD science through highlights CKD science through art, and it's the authors and co-authors, and you can see a little bit around that in relating to the collaborative efforts between academic institutions and the two social media platforms. Then the next page is to do with the kind of the contents page, and the good thing about this art book and side B as well as side A is the contents page. They don't actually have, there's no numbers actually. It's basically color coded in some context, and generally the themes are actually sort of quite are in quite sort of with the art that relates to the theme is generally the themes are highlighted actually quite well throughout. So page numbers weren't really required. So the aims around this were to help bridge gaps by adding color to chronic kidney disease, dialysis, and transplantation, using art to reflect healthcare circumstances, needs, and requirements. And the involvement aspect again was using art and photos posted on social media to connect best practices, to raise to raise issues surrounding nephrology, dialysis, and transplantation, to involve two leading patient and professional organizations, and to prevent impoverishment, health disparities, and increase health equality. And then again, one of the questions in here as well. Again, who is this for? Who's the book? Who can the book be used by? So generally, the art book is for nephrologists, all kinds of health professionals, patients and carers, RPSG members, and KDARs users. And again, the page here, highlighting about what art can do, what art does that words cannot. And so there is an inside page there, which sort of highlights that context. And I'll read what it says. So, for example, help identify strengths and limitations of how art posted through social media can help inform healthcare for kidney patients. Art to supplement health practice, highlighting different stages of health and disease, and adding color to chronic kidney disease, dialysis, and transplantation. And a little bit of intro around this in relating to the mission and the vision. So to help gain a broader understanding of how people with advanced chronic kidney disease receiving different forms of renal replacement therapy cope with healthcare through art, and seeking to solve issues and health literacy where patients use art to open up health dialogue between and irrespective of whether patients are pediatrics or young people or adults going through kidney care or kidney care practice or kidney disease. And then again, as in the case of side A, or book CKD Art Book A, CKD Art Book B is novel and first of its kind to link art, kidney care, and science. So a little bit, so I'm going to highlight some other context here. CKD Art Book B, or this book, is a little bit different in so much that there's no particular specific section that relates to pediatrics or young people and adults going through kidney disease. In here there are the themes. There's a theme, and then there's the artwork relating to the theme, and then there is a notes page, and the theme generally is specific irrespective of patients going through chronic kidney disease as pediatrics or young people or adults going through kidney disease. The theme is generally in relating to both cohorts. So, for example, one of the first themes in this book, in this art book, side B, is CKD, the fundamentals, and there is some art. There is some art there. There is some art. Sorry, there's the art there, and that's theme 1, and that is an illustration or a photo like sort of image that someone posted of the functional component of the kidneys. So it's a picture or an image of the glomeruli opened up. So you can see, for example, the afferent arteriole, the granular cells, the ascending limb of Henle, the loop, loop there, the efferent arteriole. You can see the renal corpuscle, the glomerular capsule, the capsular space. You can see the proximal convoluted tubule. You can see the sort of podocyte areas, and you can see the glomerulus around there as well. And then around this there is some sort of educational context around that. See, and then there is a notes page. So there's a notes page there. There's a notes page there. So again, patients, carers, siblings, family, friends, health professionals can use the notes page according to particular themes to document aspects relating to healthcare. The next theme is around chronic illness by volume, and there's an image here where it says you have a chronic illness when your medical records come in volumes. And so that is a picture that someone posted on the social media platform, the Renal Patient Support Group, and there is you can see some sort of there's some sort of qualitative context there on that same page. And then on the page after that, again relating to that, there is the educational context. There's the educational context, and then there's the notes page, the notes page there, just there. And throughout the book, one thing I'm going to highlight. So I won't go through all of the different themes as I've highlighted them, but one thing I will say is that the works or the images and the pictures that have been posted that have been put in this book in side B, they have been posted on the Renal Patient Support Group on the RPSG from around 2015, mid 2015, and actually it was a little bit later, in line with CKD side A, or CKD art book side A, that together it was where the research team and the moderators and the admin team around the renal patient support group in particular then had an effort or an initiative where we thought actually it'd be good to use these images, in once again in an anonymized way, to actually highlight what people have said according to that particular theme. So the qualitative, some qualitative context relates to that particular theme, and then the images. The good thing is the images, the pictures, the images are there's for example there's a mixture. There's a mixture of photographs. There's a picture, and there's the mixture of photographs. There's a mixture of sort of artwork. There's pictures of where pictures are almost like in a GIF sort of format. And one of my favorites in this has to be this one. This one here is under theme 8, and it relates to resilience. And this is a sort of is a picture of someone where they actually sketched themselves where they were attached to a dialysis machine, a hemodialysis machine, and they drew themselves drew their access attached to the dialysis machine whilst they were physically, you know, attached to the machine. And I think that's pretty amazing. The sketch, the artwork is amazing, and the there's some qualitative context there as well. And then again, there is a notes page where that can be used, so that's the theme 8 around resilience. There is and then there's the sort of educational context around that there. And yes, there's another one of another intriguing theme is theme 9, ongoing tests and investigations. And this is a mixture of where someone posted a picture of a urine dipstick test, and also there's an image where it says all your lab tests are back. They show a serious overuse of unnecessary and inappropriate tests and procedures. And here is the art around that. Again, apologies for if you can't see it very well, but that's what the art looks like. And then there's some context. There's some qualitative context next to the art, and then on the following page there's some educational context that relates to that particular theme. And then on the page after that is the notes page. There. And another theme is theme 10, which is about CKD science and research. And here is the page that relates to that particular theme. And there's some artwork there with some qualitative context. And then there's the page on notes, and then on the following page there is the educational context around that, and then there's the notes page around that as well. And yes, and so there's other themes as mentioned before, and I'm not going to go through them all, but there are then there's sort of there's a context around the Renal Patient Support Group and KDARs, which is that page, that page there. And so those are primarily, and that's under theme 18, and there's some context there. And then there's some specific educational context around the 2 social media platforms there. And then there is the notes page that can be used. And then there's a page on dedications. There's a page on further reading, and there's another page on further reading, and there is a page on authors and the and the page relating acknowledgements. And once again, as in the case with CKD art book side A, on the back page there is an overview of this work in context of an abstract, and that forms the back page over there. And so both books, so that was side B, so CKD Science Through Art, side B, and there's CKD and Evidence-Based Through Art, side A, both available through the Renal Patient Support Group to support patients in pediatrics and young people, as well as adults going through chronic kidney disease, and can be used to take notes so that patients can actually then have potentially those the context that's been shared between patient and professionals, for example, documented into the electronic patient record, and so that patients and carers and professionals in sort of follow-up any follow-up meetings and etc. that they have, that they can actually go back on those and relate them to different themes in accordance to the sort of health according to the sort of care and healthcare and sort of the care pathway that health professionals and patients sort of have discussions around, etc. So that closes this audio podcast around this audio podcast on Science Through Art side B. This has been an audio podcast series around the equity intermission, and this is a Storm Lobostics production. Thank you for taking the time to listen. Much appreciated.